the Peak Nutrition Podcast. Today, we're tackling a topic that has just exploded in the last decade and probably even more so in the last 5 years and 3 years, really, shifting from this really small niche in the medical world that you hardly ever hear about to what seems like pretty much a total cultural obsession. And that is the state of men's health and the polarizing world of testosterone and specifically TRT, testosterone replacement therapy. In 26, it feels like everybody's looking for some kind of an edge, and even people who seemingly seem really young. And I wanted to know why. How much validity is there in that? What are we chasing that seems like a myth, but in reality could also be? Is there any harm to this? There were so many great questions that we get asked that I wanted to have someone on who really knew the ins, the outs, the nuts, the bolts, and deals with this on a fairly regular basis. So we had back on our friend Dylon Sanford, who is from Henderson Family Medical in Henderson, Texas, and a good friend. And you may remember him from the podcast that we did with him on GLP-1s, maybe one of our most popular podcast episodes ever. If you've not listened to that one, then I will link that in the show notes so you can go back and check that out if you get interested as well. And so Dylan and I sit down. I had an outline of questions for him that I wanted to get his perspective on. And as always, we try to go, see this from a bigger picture rather than just answering the standard questions. And he does a really great job about doing just that. So here is Dylan and I as we cover some of the most pressing questions that we've seen and that most people have on testosterone in men, testosterone in women, and TRT. Well, Dylan, you're no stranger to the podcast, so we look forward to and enjoy having you back. But for people who are just listening, can you kind of give a brief introduction to who you are, how we know each other, what you do for a living, and why you might be the guy that I call on a topic like testosterone?
Man, my name is Dylon Sanford. I'm a PA in Henderson, Texas. I work with a clinic called Henderson Family Medicine, and we do everything from what you would consider a basic primary care place would do, where we treat people's blood pressures and cholesterols and diabetes, but we also do a lot of integrative type medicine. I think that's the buzzword now, where we're doing hormone replacement, and we do some peptide stuff. We do weight loss. We do all that kind of stuff. Of course, as appropriate. But that's what's fun. Now, to answer why in the world that you would have me on here, I have no clue. I don't belong in the same room as some of the guys that you've had on here, but I definitely appreciate it. So.
Well, I will add two more accolades to your growing list of credentials, and that is humble to say it. You're on here because you're an expert in it. And the second is chef extraordinaire. Like we had
Oh,
the opportunity to come down and spend some time with you, and you definitely know how to cook some excellent Southern food. So
man, I
we
appreciate
appreciate
that.
you, and I'm looking forward to this. All right, so I have testosterone is such a massive topic. You have the blood work side of things, you have the growing popularity of replacement therapy, you have things like an online presence in forums where everyone is going into a conversation or a podcast like this having had heard something from someone, whether truth or inaccurate, they've heard something. So I've tried to sort of view that as a whole and then give us basically a series of 6 questions to try to answer to make the most sense of this in the plainest language possible for all of us, including myself, to take away. But I think a good place to start would be sort of stepping back from all of that technicality and looking at what I've kind of labeled as the state of men's health in 2026. You've been doing this for a fair bit, meaning practicing with different people. I guess I have 2 questions. One, what have you seen change with the state of men's health over the last 10 years to where it seems like if you're 40, you need to be on TRT? And I'm not saying that as a
Mhm.
recommendation or a fact. I'm saying that that's what the perception is.
Okay.
What have you seen change over the, let's call it the last 5 to 10 years that you've been practicing, and why do you think that change has come about?
So I think I want to make sure that I am um, honest here where I say, sometimes I feel like an ostrich because I've got my head in the sand, just kind of grinding and doing our work. I will say two sides of this. One is I actually see it maybe from the opposite perspective, which is where we were trained in school, any version of a hormone was an absolute no-no. And so I've actually seen, I think, kind of what you're saying is, and potentially even leading to some of these misconceptions, which is this other pendulum shift of, hey, we went from you absolutely cannot do any hormones for anyone, no matter what. And then it's shifting to, yeah, the moment you get the sniffles, it's probably your testosterone, right? And so we want to make sure that neither of those are true. I don't know if it's a consumerism perspective of if we're just getting potentially more busy and have um, relatively more disposable income where we can go, hey, I can't put in the work that it takes to do X, Y, and Z. So give me the pill, give me the shot, give me the whatever, which of course that would be somewhat transferable from our last episode on the GLPs. Yeah, I don't know, man. I definitely think there's an awakening to it, regardless whether it's true or not, whether people come to an actual true conclusion about what they need. Again, largely educated by social media. I definitely think there's an awakening to this idea of men's health and of needing hormone replacement for sure.
The consumerism comment is an interesting one and a good point. For I think for me, I don't want to say that a trend that I have seen, but thoughts that I have had would be number one is that, which is now there is, I mean, you sort of stated it perfectly. Now there is a viable solution for problems that we have, whether we don't want to fix them, whether they seem too much work to fix, quote, naturally, whether we don't have the time to fix them, quote, naturally, or whatever. Now there is a solution. Whereas if you would have talked, I mean, if you would have told my dad 15, 20 years ago to go inject or to take topical testosterone, you're like, you want me to be on drugs? No, like that would basically be like you're recommending cocaine or heroin to him.
Exactly.
And that, of course, that's not the same. And the other interesting thing that I think we are seeing, and if you have thoughts on this, you're welcome to provide the input, or we might even tease this out as the podcast goes on, is because virtually every person's life is broadcast through social media in some way, shape, or form. Everyone has an opinion from the most popular celebrity, thinking about like Rogan, Cam Hanes, some of those guys, to your everyday, average, common person who's a dad and husband and works a day job. They're all talking about what they're doing, really,
Mhm.
right? And it's made me wonder if most of us don't have if our like, let's say that some lab values came back, they're within normal limits, but they're on the low end. Boy, I sure
Mhm.
would love to see what those are in optimal. If it's
Mhm.
this constant pursuit of an optimal level whenever that may not necessarily be warranted. And so now
Right.
there's a combination of pursuing absolute perfection with a viable source like that. All that equates to is, yeah, sign me up. Why wouldn't I? You know?
Right.
So yeah, I don't know that there is an answer there. You're welcome to weigh in more on that, but those have been the two thoughts I've had.
I do think there's an interesting point of human psychology there where I can't think of like a really great example, but the idea of a I don't like the word handout, but the idea of a relief where if somebody's doing an exercise or saying maybe on a run and it's almost this idea of, hey, if I'm you know uh, if you just make it a little bit further, I've got a snack for you up here, or hey, the bus is ready to take you if you'll just get on the bus and they'll take you to the next checkpoint or something like that. The option in someone's head of relief of I don't have to do this all, whereas they could have completed the whole thing if they wanted to. But when you add option B in there, now the brain is I don't want to say forced, but um, in one sense forced to then make a decision. Hey, this was never even on the table before. I didn't even have to worry about this option, but now I do. And particularly for this, it's an option, like I said, of relief potentially.
Yep. Great. Excellent. Excellent points. All right. So topic two, going into this, getting tested, the results and what their meaning is. I'd love to sort of get into some input from you along the lines of the lab values, getting tested, assessing the results of those lab values, and then trying to make a determination whenever it's worth intervention and when it's not. What lab tests are most relevant for men to get and look at when trying to assess if treatment should be an option?
I'm going to use a famous Kyle Camp answer here and say it depends. Uh, yeah, no, it depends. I will say, frankly, a regular total testosterone is actually really good in both men and women. I know we kind of were talking about, men's health particularly, but we do a lot of hormone replacement in females as well. And you want to talk about life-changing results for the folks who do need it. It's one of those that we will always check hormone panels on all of our patients who are looking for some help there. But yes, honestly, a total testosterone, you can get into the weeds if you like and make sure that the looking for other things called DHEA or estrogen, a SHBG, which is called a sex hormone binding globulin, little things like that to see if we are maybe making the right hormones, but then binding them up, or if we're converting them out of their primary form, things along those lines.
All right,
But
let me stop you there really quick
yeah, go for
because
it.
that's all like money, and that just gives me three questions to spin off.
I love it.
So number one, I will get hate emails if I don't ask what role testosterone plays in women's health. Why is there value in looking at replacement for women if they test low on testosterone? So
Yeah.
I want to visit that. And then when we get done with that, and this, I'm just telling you this now because I'll forget if I don't. I want to go back and revisit this idea of total and then these sort of nuanced, because the question that we get the most often is, and we help direct people when they ask this, but not everybody's getting this tested. The question we get the most often is, my bound testosterone was fine, but my free was not. It was low.
Hmm.
Or all my testosterone numbers were level, but my SB, my sex binding globulin
Hmm.
hormone was too low. What does that
Hmm.
mean?
Right, right, right.
There are innumerable avenues that you can go down when this is low, this is high, and this is high, this is low. But I would love to, as a second part of our question, after we take care of the ladies, um, talk a little bit just about that as a generality where sometimes things can look normal, other times things can look low, and that can suggest something versus the inverse would suggest something different.
Sure.
All right, take it away for the ladies.
So on the lays, one thing to consider is um, the whole concept of units, right? So if I said, "Hey, man, I woke up and I ran 5 today," five what, right? 5 miles, 5 meters, 5 hours. That is actually the same thing when you're looking at lab values. It looks based on just sheer numbers that ladies have significantly less testosterone than estrogen, progesterone, et cetera. However, if you do look at the units that they're measured in, ladies actually have significantly more testosterone than they do estrogen or otherwise. So go ahead.
Because they're measuring it in nanograms versus
Per deciliter.
milligrams.
That's right.
Exactly. Okay.
Right. Yep. And so the point is there it is still a vital hormone for ladies. We so this is fun. Okay. So when you look at um, basic human physiology, we actually know, and we'll say pretty regularly, after about 30, 35, ladies aren't adding any more bone mass to their systems, and you will actually notice that a lot of their sex hormones tend to start to fall off about that time. Anywhere about 35, 40, somewhere in there is when these testosterones start to dip. Even estrogen can, depending on how their menstrual cycles are, etc. And a lot of times that comes with then the symptoms of low testosterone, which we can get into, and I'm sure we will. But it's interesting that we have tracked those hormones across this area, and it's just funny because one um, type of outfall, like the bone mass and et cetera, is very commonly known and discussed. Yet the rest of them, I feel like probably aren't. Again, some of the other symptoms of the low testosterone, et cetera. So,
So the basic synopsis of that is if ladies go and get their hormones tested and they see a low testosterone, it is not just because they are a woman, it is because they
mm-mm,
are producing less, and that can start to manifest symptoms or feelings that lead to their quality of life, low energy
absolutely.
level, inadequate muscle mass, inability to build muscle,
Right.
those type of things.
Yes.
This may or may not be a good point to insert this because this is a question I had for later for both men and women, but it seems like it fits here. If you have a low testosterone and you begin getting hormone replacement therapy, in other words, you begin getting treatment for these things, will that alone, no other factor considered, take down belly fat?
Oh, Kyle. I'm going to say no. Uh,
Okay, we'll
I
get into
will.
the details of that later.
Yes, yes. I have a study that says semi otherwise, but I'm going to say no because there's got to be some version of a metabolic shift that happens um, within that human as well.
All right, I'm gonna stop there too because I know you are. We'll go to back to that later.
Yeah.
Okay, revisiting the topic from before, which is you get lab values drawn. Sometimes testosterone can look normal, but other lab values tied to hormones can look abnormally low, and sometimes the inverse of that happens. I know this is an it depends, and the ultimate answer is you need to see a provider to make sense of those. But is there anything that you would suggest people pay attention to in particular when getting all of those labs drawn? And or is there more weight that you give to free versus bound testosterone when people think that they have a low testosterone number, is there a lab value that you give more weight to than another? That's probably a better question.
So I think this is a good time to discuss the difference in normal versus optimal, right? So yes, in one sense, are we trying to take people from where they are and optimize them? Absolutely, we are. Um, at the same time, what you have to look at is how are normal lab values obtained, right? They are on a bell curve, a population bell curve. And so what you're looking at is if you are smack dab in the middle of that bell curve, that doesn't mean that you are um, just firing on all cylinders. That means you are 50% right in the population average of what is, again, normal. So the thing about it is we really do use labs to help guide us, but I r- try to keep it simple, at least in starting with our initial lab work, and then if we are having problems with testosterone or hormone replacement, I will then start to go dig into some of the more nuanced proteins, hormones, etc. So to answer your question, honestly, The regular, like I said earlier, total testosterone is in males is a great one. I'll also use what we call an FSH for ladies, and an estrogen as well. Um, the what I weight more than and folks should too. What I weight more than lab values is symptoms. If you're having zero symptoms and you feel awesome, you're firing on all cylinders, everything is going great, and you come back with a if you're a guy, you come back with a testosterone of 200, I'm not doing anything to you, right? You feel great. Okay. Now, if you feel awful and you come back with a testosterone of 700, 800, well, then it's probably not your testosterone. But I'm not opposed to barking up that tree if I have to, right? I'm going to start looking for other causes, don't get me wrong. But here's the thing, it just in good science, let's say you come back, you feel awful with a testosterone of 700, and I give you testosterone and you feel like $1,000,000 and you're 900. Well, then guess what? Apparently that's what you needed, right? I don't like the idea, frankly. I would rather it fit into a different category, but you have to do what helps people as well.
Okay. That was excellent. That was excellent. That was better than any question I could have asked you. So let's pull on that thread a little bit more and say this. If someone, and I guess to some degree you already answered that, but if someone comes in and is at a normal level, but says, "Oh, I'm so exhausted all the time. I'm
Sure.
so insert, several of the different symptoms." I guess I have two questions here, of course, like always. Number one, you look at their lifestyle and you see, well, you sleep like crap, you
Hmm.
live on gas station burritos, Monster Energy drinks, and packs of Zen. You don't strength train. You haven't
Okay.
seen a fruits or veggies in years.
Hmm.
At what point are you just going straight into therapeutic intervention, i.e., TRT? And
Sure.
at what point are you saying, I am willing to bet that if you corrected those, you may feel better? And as a part of that question, will a person who takes TRT but does not correct that lifestyle that I just mentioned feel any improvement?
Sure. Uh, so I will always ask people, how are they sleeping? How is their exercise? How is their nutrition? That those are pillars of health. Frankly, that if people just did that outside of genetics, I probably wouldn't have a job, right? Um, but um, I will. I don't like this answer, but I'm going to answer it honestly. You will see people that do have improvement even when they don't um, change their lifestyle for sure. What's been interesting is sometimes that difference is, let's say that what I mean by that difference, the difference of adding in testosterone back into the system tends to be the catalyst that then allows them to feel good enough to go then take care of themselves. I wish it would happen the other way around, right? I wish they would have the self-care and the self-worth to start it the other way. But I really do tend to see, especially down here where we live, I tend to see, someone drags themselves in and they feel awful, and then we look at what their entire life looks like. And just to be honest with you, I mean, I have grown men kicking and screaming in here. I will not eat my vegetables. And I'm like, okay, adults do, but that's fine. And so the 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 reality is a lot of times if I can get somebody to feel good and let them see some progress, they will then start investing in their health. And all of a sudden, hey man, those monsters went away because they didn't feel so exhausted. Hey, their sleep got better, which does happen with testosterone, but not always, I guess, but can happen. They did start to gain a little bit of muscle. They then said, oh, you know what, I need to really go double down on this exercise thing. And before you know it, we quit smoking and we're down 50 pounds, and on and on and on. And I have multiple patients that have done it kind of the backwards way in one sense. I'm so glad that we ended up kind of at the same point one way or another, right? But yeah.
Is so in those scenarios, is the goal like we'll compare this sort of to GLP-1s, and I'll link that podcast we did in this too. Is the goal eventual weaning of TRT in a scenario like that? And then I have another question after that.
The goal is symptom relief. So if they are um, able to make their own testosterone, and that is adequate to provide them with the quality of life that they desire, then we're good. If there seems to be some other version of physiologic uh, loss of the ability to produce testosterone. Andropause is a real thing. If they do not want to produce it, then yes, we will replace.
Okay.
I do have people, by the way, who have done that though, who have we've been on some version of testosterone replacement, and they have gotten the rest of the other categories back in line, and I'll come back, see them 6 months later, and they're like, man, I haven't used this in months, and I'm feeling better. And it's like, okay, go for
So
it.
here's two questions off of that. Is there, if you have a person, like let's just use this avatar, this fake person. If you have a person, this person that we're mentioning that has, gone on TRT, improved, etc. Will they need increasing doses over time to reach therapeutic levels? And or is there a ceiling? In other words, let's say that I'm going to make up numbers here just for the sake of understanding for people.
Hmm.
Let's say that I give them 1 unit. That unit is effective for 3 months, but now they need 2 units. Their testosterone increases a little bit more, and 3 units, and then it increases a little bit more. Is there ever a point where if you reach 25 units, it's never going to get any better than it already is?
Right.
Do both of those questions make sense?
They do. There are some loose rules about that. So the first part of that question is the answer is no. Um, People do not need continually higher doses. Does we Whatever dose works for you is whatever dose works for you, because we're looking at a certain concentration of testosterone. Typically, we there's going to be some version of a soft ceiling of plasma concentration of testosterone, that past that you're not seeing any benefit and really only going to see some side effects.
So there is a saturation point in which it's like, for you, I can't give you, there is no more juice to be squeezed out of this, even if
That's
I
right.
wanted to keep piling it in.
That's right.
Because you mentioned it here, what are the side effects of continually pushing that dosage higher without seeing any symptom relief or increase in plasma, etc.?
Sometimes those side effects come on at any concentration, and sometimes they are dose dependent. So, like, you might see increased acne with any amount of testosterone, but you're not going to see problems in your cholesterol maybe until what people want to call quote supraphysiologic doses. In
So
fact, I was going to
cholesterol
say,
could go up, acne can increase,
sure.
other
Oh my
risks.
gosh. Oh, yeah, 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 plenty. Plenty. But most of them are
Let,
manageable.
let's save that. Let's save the risks. I just wanted
Okay.
to see if there were others.
Oh yeah.
The potential side effects of this are the same for both men and women, just even in the two that you just referenced.
No. Yeah, not the case actually. Typically with ladies, the most you see on side effects, um, specifically for ladies, is going to be again some acne. What that does, what testosterone does, is it activates oil glands within the skin. So that can actually be really helpful. Some people will have really dry skin, really thin hair, brittle hair, etc., and it will help with that. But it can also do some overproducing, so to speak. Um, and then you can get, in ladies, you can get some unwanted hair growth as well.
Okay. The biggest question, hands down, question I see asked the most. When you go on TRT, does your body naturally begin stopping production of natural testosterone? Does it slow it? Does it stop it? Does it? And, well, let's get your answer there and then I'll ask the second part.
The answer is yes. If you are producing or if you are replacing testosterone in and of itself. So there are other options, like you could use Clomid or HCG or something like that, that would not. You're essentially upregulating the signal for your body to produce testosterone. But if you are replacing the end hormone of the system, which would be testosterone, your body will stop making it. Now, that is not forever. It will come back, but it will stop making it. Your body's a survival machine. If you're gonna give it what it needs, it's gonna say, "Hey, man, I'm good. You're replacing this for me," which is why normally the testosterone doses, at least to start, tend to be kind of blanketed. The reason I mean that, or reason I say that, is because it's not like an addition problem. If your testosterone is 600 and you feel great at 900, I don't need to give you 300. I have to give you whatever the typical recommended doses is, because what's going to happen is your body's just going to go back down to, let's just say, zero, and then it's going to rely on everything that I use to replace it. And again, that's just with testosterone itself.
Will when however it does decide to kick back in, which I would imagine is a titrating dose downwards in TRT, does it go back to producing its normal natural amount or is it lower than previously?
You will go back to your pre-replacement levels.
Okay. So you have two things going on here and we're sort of jumping ahead with the TRT thing, but that's great. You have one method of TRT, testosterone replacement therapy, that triggers the gland responsible for the production of testosterone. It's basically knocking on the door and saying, "Hey, we want you to sort of pick up your pace a little bit." And so, in that sense, you are not replacing the hormone in and of itself. But scenario two would be you are replacing the hormone itself.
Right.
Scenario one does not reduce how much testosterone you're producing naturally. It's actually saying, "Hey, you need to pick up the pace a little bit."
Right.
Whereas in scenario two, the replacement of the actual hormone itself will cue your body to say, "Hey, you're getting enough from somewhere, so we're not going to work as hard." But that's not necessarily permanent. And if you decide to come back off of that, you'll go back to your normal baseline levels.
Mhm. Correct.
Okay. Um, what other? Oh, okay. Here's kind of the next topic. Although my topic theory is blown at this point, which is great. I actually like this better. Explain to me the all of the options as far as administration of TRT.
Mhm. So if we want to knock out the indirect methods first, that would be easiest. Imagine, hormones work in the body would, we call it a cascade. So typically it's like it's a chain reaction of chemicals, and those reactions are regulated basically like a thermostat. So you have checks and balances. And so if you look at basically think like cutting down a tree. If you the further up the tree you go, and by up I mean closer to the trunk. The closer to the trunk you cut that limb, the more branches are affected, if that makes sense. And so it actually is advantageous, really, to just replace the single hormone you're trying to replace, as opposed to elevate a different signal hormone, et cetera, because what you're going to end up getting is these kind of offshoots, if that makes sense, of side effects, because we're affecting other hormones. So, but You can use Clomid or Clomiphene. Clomiphene boosts a hormone called LH, luteinizing hormone. And this is actually used on label in folks who are struggling to get pregnant. And so we have seen it both in men and women, use both in men and women. It will, in a guy, it will modestly raise his testosterone as well as a sperm count. In ladies, it doesn't do that at all. It just produces and encourages ovulation, and so that is an option. You can boost LH. The
So is
Go
that
ahead.
is that oral?
It is. Mm-hmm.
Okay, so we have an
Mm-hmm.
oral method.
Yep. Take it about 3 times a week.
Okay, what are the other? So if we're talking strictly administration of the different methods.
Oh yeah. Yep. So yeah, you have oral. That is about your only acceptable oral replacement across the board. Uh, your Outside of that, to knock this one out, you could do HCG, like what they measure in a pregnant lady's urine. Um, HCG does stimulate the testes to produce testosterone. It does not work in females. It only produces progesterone at the ovaries. So it's a male only thing, and it comes with gynecomastia risks, and so it's not a super great option. The When you get into testosterone proper, you've got pretty much oral. Any other hormone, oral replacement is just out of the question for me for two reasons. One, your what we call your bioavailability is extremely low, so you end up having to take a ton of drug to get very little effect, if that makes sense. And then, so where does that drug go? It goes through this thing we call first pass metabolism through the liver, which ends up creating a bunch of different, um, let's just say, side effect chemicals. The liver, as it's processing that hormone, is going to shoot off all of these other different hormones and clotting factors and all these other things. So we don't care for it. So we want to replace outside of swallowing a pill. So we have to go. I always tell my patients, just as a kind of rule of thumb, I say, I've got to go through the skin one way or another, right? So you can do what we call a troche, which is a dissolvable mouth lozenge, kind of like one of those soft peppermints, if that makes sense. Um, then another option would be a cream. You just put it on over any major artery, and it'll dissolve into the bloodstream that direction. And then you have injections. You can inject testosterone and estrogen, as well as for estrogen replacement, you could do a patch. Um, and then we have pellets, which are kind of the subcutaneous, long-term administration.
I know this is a very, let's caveat this question with the value to peak phrase of all phrases, which is it depends and it's highly variable and based on the
Yep.
individual and preferences and all of that. If you absolutely could only deliver one method, what do you like the best when weighing efficacy, safety, and low risk?
I am hands down a pellet guy. We use every single method that I just mentioned to you, but pellets to me are just without a doubt so much easier. They are lower maintenance for everyone. So for ladies, it's every 3 months. For guys, it's every six. Um, they are slower to release, which is actually a good thing. I mean, obviously they're slower to release. They last 3 to 6 months. But what I mean is even the ramp up, so to speak, of hormone concentration is slower than should you use these other methods, and we tend to see less side effects because of that in men and women. And it does seem that they work better. Also, the maintenance. I always tell my patients, hey, this is like a Cadillac. You are paying for, they are more expensive, but you are paying for the convenience of not having to tote around all your hormones all over the place. If you're going on vacation or whatever, this is a, hey, we put it in, get it done, see you in 3 to 6 months kind of thing. The other thing that I love about them is they are by far the easiest to adjust and check on how we did. That it is so regimented, and I can make such minor micro adjustments into someone's hormones, as opposed to the other ones. It truly is. I hate to say it this way because it sounds terrible, but it truly is flying blind for a while. You have to go off of primarily symptoms. Blood concentrations are not very reliable. It's just tough.
Yeah, and for people who are listening, like that's most of the medical community. I mean, you are describing symptoms to your doctor. Sometimes you have blood work. This is very true of nutrition. You're trying to work with someone who's experienced to make their best judgment, and then you observe. And then after that initial observation, you have a much better collection of data to make very, very precise and educated adjustments off of. So that makes sense to me. For people who don't know what a pellet is, can you kind of describe what they are, how they're administered, where they sit?
Yeah, so what we do is we use a pellet that is what they call bioidentical, meaning if you took the hormone that we are putting in you and the actual hormone that you made once upon a time and put them under an electron microscope, they would be actual identical representations of each other.
Is there, so this is inserted under the skin.
Mhm.
I mean, it is slowly dissolving over time, which is getting into your bloodstream, which should be therapeutic, adjusting your levels and helping you feel better. Do you ever see, and I'm sure this is a very small sample size, but question nonetheless, do you ever see where people's body reject the pellets because it is essentially this foreign object being inserted?
Yes, we do. It is very rare, but typically that rejection rate went way down when the pellets that we used started being coated with this very trace amount of triamcinolone, which is a steroid. So what a steroid does is it tells your immune system to stop working, which sounds super scary. But from this local aspect, what ends up happening is the inflammation response of dropping those pellets in, of course, is going to draw in an immune response to that site. And so if we coat these little guys in a steroid, that is going to call off the immune system to that local response, which allows the inflammation to go down, the site to heal, and then off you go. And again, since it is bioidentical, there's not going to be any antigens on that hormone itself that are going to tell the immune system, hey, you need to go attack this.
All right. So let's say there's people that are listening and they're like, oh, gosh, sounds like everything I've ever hoped and dreamed for. What are the risks? What are the main risks tied to TRT as a whole?
For sure. So we already had mentioned a little bit of the acne, et cetera, hair growth, you name it. In almost all patients, I will see some version of a weight gain post testosterone. This is normal. It is not fat because it's going to happen within about a week. You will see a 5 to 10 pound gain. Testosterone is pushing water back into the muscles. And like I said, this is true across the board. You'll see it on the scale, and you won't see it in the mirror. So there's that one. I have had it go too far at times where we've had some big fluid retention problems, but we give somebody a Lasix, and 2 days later they're better. And it doesn't keep coming back, even though they just had pellets. It's kind of this one kind of application thing. It just happens and then it goes away. Um, the For men, I tend to see blood pressure increases, which we obviously do not care for. That can come because testosterone does tend to raise your blood counts as, again, a man. Ladies do not have the dose that it takes to cause blood count increases, um, which a common misconception, by the way, is that it could give you blood clots. That's deeply rooted in a few different lies. However, for the male perspective, when we're talking about what we would call the famous, or medical term is secondary polycythemia, but what you get, there's three people who get secondary polycythemia. It's testosterone users, it is high mountain athletes, and it is smokers, right? All of them, well, the smoker and the high mountain athlete is due to some version of oxygen deprivation. The the testosterone user is a completely different mechanism that comes from the pulsing of the testosterone into the liver that causes the signals to make blood cells, blah, 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 blah. But all that to say, we don't see blood clots with it. I will let your blood counts come up just a little bit, and I'll let them ride just a little high as long as you're feeling fine. As long as your platelets are normal, I don't see an increased clot risk. Outside of that, man, it's like I said, at the super physiologic levels, you can get cholesterol changes. Um, I'm gonna tell you so your people aren't shocked if they ever get it. If you're a guy, there is testicular atrophy. It also will decrease sperm count. And so if you are trying to start a family, this is not the time to do the old TRT. Outside of that, it can mess with your prostate a little bit. Again, it tends to be pretty rare. It does not cause prostate cancer at all, but it can grow a prostate cancer if you have it. So you definitely want to be making sure that if you're over 40, you're getting regular PSA checks, which is, of course, a blood test. And yeah, typically that's about it. The only other thing is we haven't talked about like what happens to testosterone itself, but you can see basically what happens with testosterone is it either stays testosterone or it gets aromatized into estrogen. If we make too much estrogen as a guy, it could cause gynecomastia, etc. That can be fixed very easily. It could also convert to DHT. DHT is really what messes with the prostate a little bit more. Can change, like if you see a guy who's bald and he's on testosterone, it can mess with the hair follicles on the head, etc. So that's really about it.
Okay.
As if that wasn't enough.
So a couple of I guess two other questions that sort of always come up. Will TRT cause heart attacks?
No, that actually those studies were actually taken off of the FDA website.
Okay.
Actually found cardiovascular protective benefits from hormone replacement.
Is TRT or does TRT act like a steroid for weightlifters?
Hmm. It would depend what you mean by acting like a steroid.
Will TRT help you put on lean muscle mass that would otherwise be unable to achieve without it naturally?
It depends on what your starting levels were. But let's say you were normal. Let's say you were optimal and you injected TRT for specifically muscle gain purposes. I don't think you're going to see much of a change at all. If you were low and then you injected it, you will see muscle gains. I will say, and I say it to all my patients, but you got to go earn it.
Okay, so that was the scenario that I was thinking of, which is if you're low, unable to go to the gym or unable to be consistent at the gym, and then you get on replacement therapy that improves your energy levels, that improves your ability to push while at the gym. If you are following a training plan that is progressive overload and you are consistent, that's going to be the real hero here, not necessarily
Mhm.
the TRT by itself.
Absolutely. The TRT, well, the testosterone level could be your natural testosterone level could be a limiting factor as to why you're not seeing the progress that you might need. But it is not in and of itself going to be the catalyst alone. You've got to, like I said, you've got to do the work.
So similar to like a GLP with weight loss in the sense of the GLP is not the magic, it's the work you're doing while on the GLP that aids you to produce the weight loss.
GLPs do not cause you to burn more calories. They only simply make the hunger hurt less, right? And I've got people on, diabetics, of course, but I've got people on 15 milligrams of Mounjaro completely maxed out there, and they are still gaining weight.
All right. Last topic. Can we and how do we increase our testosterone naturally?
So you've got a couple of options here. I went through and did a whole peer-reviewed research review on all of this to see is there anything that would naturally increase people's testosterone. number one is going to be weight loss. It is going to help typically because what happens in adipose, aka fat tissue, is adipose contains a lot of aromatase enzymes, which are going to take someone's natural testosterone and have them what we call aromatize that into estrogen. So, yes, we will see elevated estrogen to testosterone ratios in someone who is significantly overweight. So, on average, if you lose about 10% of your body weight, you are going to see somewhere in the it's modest, but about 50 to 100 points, 150 points increase in your testosterone. It does obviously matter what your starting body weight was, but yeah, that's the idea there. In ladies, however, that does not quite pan out. It almost actually works opposite. So that's one. Another one is sleep. So in men, sleep modestly will increase your testosterone as your sleep increases. It's kind of a linear progression up to a point. Um, but it again is very modest. It's only about 6 points of testosterone, which again we've talked about nanograms per deciliter. So I'm just saying points, but 6 points per additional hour of sleep. That's really, frankly, just because the sleep is improving how your brain is working, which is going to, because your brain, if you don't know, your brain is actually what regulates all of your hormones. It comes out of a part of your brain, and everything flows, downhill from there. And then exercise, can. What's interesting is it's kind of this twofold effect on exercise. The the testosterone levels in men and women do seem to rise after an intense bout of exercise, and they last only about 30 minutes or so. Outside of that, you're not going to see lasting testosterone rises as far as within the 24-hour day. However, it did seem that if folks participated in a high intensity interval training type of exercise over, I believe it was a 12-week period or so, they did see some significant resting testosterone level increases. But it does seem, like I said, that the intensity, your overall activity level, your exercise intensity, were the main uh, controllable variables, the things that actually move the needle the most. But obviously, your obesity and age and things like that would serve to either make it better for you to, like, you would see more improvement or you would see less improvement based on that as well. So there were a few little caveats. And then supplements, there's a lot of stuff. Listen, if I won't, I'm not going to say if you take nothing away from this podcast, this was it. But Lord, I just can't stand it when people waste their own money. Um, Anything that is marketed to you that says it will increase your testosterone is probably a lie. Any, I don't want to name names, but anything at your local nutrition shop is going to that says it's going to raise your testosterone. I'm sorry, it's not. And those things, honestly, too, Kyle, they're like $100 for a bottle of whatever. It is such a ripoff. So yes, nothing in there. There actually is some studies on this supplement called Indonesian Tongat Ali that does help raise people's testosterone. But since you guys are now hormone experts, what it is really is what we call an aromatase inhibitor. So what it does is it keeps your testosterone from breaking down into estrogen. That's it, man.
And because you'd mentioned this on the other benefits, is there a quote like point increase from taking that supplement that you can expect?
What do you mean? What do you mean?
Like you had said, weight loss of 10% or more when it's needed can boost that number by 100 to 150 points. Better sleep
Oh
can
yeah,
increase it by 6 points per hour linearly.
sure.
Is there anything with this supplement that is suggested what type of boost you might get?
So
And and
in
and and maybe an easier question than my long-worded one would be, are they is that going to even though there are studies that show improvement, is it not just because studies will say whether something is statistically significant,
Mhm,
which is
mhm.
numbers, but
Right.
really all the public cares about is, am I going to feel it?
Right, yeah, yeah.
Is taking that going to be the difference in increasing that and changing a person's quality of life?
Yeah, I didn't see anything that said so. I will say if you're wanting to talk numbers on the especially the Tongat Ali, you're what you could probably internally reason is let's just say a guy's testosterone is 500. Let's say for discussion purposes his estrogen is 25. Well, if I'm giving him something that is going to decrease the amount of estrogen that he makes out of that testosterone, it stands to reason that I've only got about a 25 point window to play with, if that makes
Okay.
sense. So
Okay.
it depends. I don't think you're going to see much of an increase of relief of symptoms at a 25 increase. But again, you'd have to ask the patient.
But I agree with you 100%. I agree with you 100%. But what I love the most about that entire topic is that if you have someone who is really hesitant for one reason or another, be it financially or they don't like the idea of putting something, I know that this is kind of misguided, but quote unquote unnatural in or on their body, whatever reason, there is potential out there to go get 200 point boost
Hmm.
through free simple, consistent changes that you could try and see if you notice a difference. My personal experience, and this, I would say this excludes the clinical crowd where they literally have hormone dysfunction because of for whatever reason, down regulation or an insufficient gland producing that hormone, whatever. So exclude the clinical crowd. When someone starts to sleep better, move more, eat
Hmm.
better, they I don't know that I've met someone who doesn't say I felt. In fact, I was talking to someone over the weekend who did this. Minimal changes, but in all three of those areas, they're like, I feel 25.
Yeah.
20, like, and that and his preface to me in saying that was, it's not going to come as a shock to you. And I would say it doesn't come as a shock to me, not so much because of how often we hear those comments, and I'm sure that you do too, but for two reasons. One, it's logical. Two, that is very much my story, right? I mean,
Hmm.
the way that I feel now compared to whenever I weighed whatever it was, is night and day, largely just because of those things. So yeah, that's awesome. I think that that's a hopeful and good takeaway. Anything we didn't cover that you want to throw in
Hmm.
here as we start to wind down?
Yeah, maybe two. Let me get this one out of the way real quick. The the vast majority of medical professionals were trained in a way and before the time that, like I had mentioned earlier, they were trained in a way that hormones were the enemy. And so I hate to say this, but the reality is our medical professionals, including myself, when we don't understand something, we instantly just throw it off. We go, no, 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 don't worry about that, et cetera. And that's not right. We shouldn't do that, right? We should be teachable. We should be able to look at new data. What you learned in school is not always true. Okay. And my point is I don't want someone to feel dejected because they went to their doctor with a legitimate concern, and because the doctor did not know how to treat this, that they just kind of brushed it off as hey, this is not a big deal. You were in quote normal range. Most people, their providers will refuse to even draw these labs for them. So I would recommend either going through a third party and doing your labs there. There's so many people out now doing these, completely, extensive, hormone, and some of that may or may not be useful. It's probably some financial gain there. But just I guess just be with somebody who actually knows how to do this, but also at the same time have your antennas up and knowing that people who are replacing your hormones are probably also financially motivated to replace your hormones. So it's kind of like this little bit of a double standard, if that makes sense. And so just be wise is what I'm getting at.
I think that's an excellent takeaway. And to me, one of the things that stands out the most about what you had said, because this is where I think we all get caught, and what I see catching people most often in the conversations that I have every day, which is if you feel if you feel great and you don't feel like you're checking any of those boxes, don't go, like the phrase that we use all the time, don't go pursuing the zebra in the pack of horses. Don't go
Right.
looking for something that doesn't exist. On the flip side, if you're checking all of the boxes with sleep and nutrition and you still don't feel great, see what
Yeah.
other opportunities are out there. But we get so I think that, like, I hate to keep bringing up social media because I don't want to be this alarmist and like say how bad it is and all of that stuff. But I do think that there is a constant perception in front of us is that life is better in one way,
Hmm.
shape, or form, right? That could be in how you feel, that could be in how you train, that could be in how much money you make and what you have and what your job is. And that could be, there's always something that seems like it's better. And sometimes there's not. And so if you feel great, let that be all the validation that you need to just trust that you feel good and be
Yeah.
grateful you do.
Absolutely, absolutely. I would say though, in that same vein, I really love now. Again, be a scientist of yourself. I really love to nerd out and see what normal looks like for you. So the reason is because the moment that you're not normal, you don't know what normal was, right? And so if your normal is a 400 testosterone and you're feeling awesome and firing on all cylinders, well, when something something happens and you go and draw this, well, you don't know what you started at, right? And so, and frankly, trends are also super important and all that kind of stuff. So yes, do go get get tested regularly and make sure that, I always joke with my patients, say, don't die from stupid stuff we could already, cure. But yeah, I mean, I would definitely say, use your symptoms as your guide there. And like I said, be a scientist of yourself.
Yeah, baselines are great to have, but thank you, man. This has been awesome, and I will definitely link our show from the GLP-1s in here too for people that want to listen to part two of that and your contact information from that episode as well. And anything else I forgot? Anything you want to leave with?
Man, I will say, just if you don't mind, you are welcome to throw my email into the description down there. If people want to reach out with questions or lab values or something like that, I'll do my very best to try to get back to them and try to point them in the right direction.
You got it. I'll put it in there. Well, thanks, man. It's been awesome. Appreciate you.
Yeah, it's a pleasure. I appreciate it, buddy. I didn't plug it. I almost did. But your 8-week challenge thing. What is this? What you like? It was
Yeah.
in it was in the show description of your last episode, and y'all didn't even mention it. I'm like, what?
Yeah, so we created that. We've been creating that. We put it on the website. We've been kind of playing with and testing it. And I anticipated putting that episode out at the beginning of April and just started looking at like the episodes that I've recorded and what's coming up and decided I wanted to just put that one out sooner. So I launched it. And like I'm thinking nobody reads the show notes. It's not going to be a big deal. Dude, people blew that contest up. And the problem with it was it wasn't fully vetted. So there was the first, it's supposed to it's set up for 8 weeks for
Yeah,
the main 5 days, not weekends, but the main 5 days to send you one encouraging video per day for this
yeah,
8-week challenge. And the very first video when you sign up is kind of like the core of the challenge. It's not long, it's 11 minutes. It's just designed to sort of give you an idea of what you're in for 8 weeks. And then I think it's at the end of every fourth week, it's designed to have you kind of check in. And the goal is for you to get whatever you want out of it. But within the challenge, there's basically 8 fundamentals that you're working on, ranging from protein, water intake, daily movement, just kind of exactly what we just talked about, just good habits to do every day. And the challenge is this: my guarantee is that if you do that for 8 solid weeks, if you see absolutely no change at all, then I will coach you for free for a month
I love it.
and figure out why.
Yeah.
Because you won't. You will. If
Like,
now there are, and like they'll get emails that say this, there are stipulations attached to that. Like you have to
mhm,
genuinely show that you've been applying yourself for those, for
right.
the course of those 8 weeks. But if you're doing that and you don't, there's a reason why. And if you've put forth 8 weeks of effort and you're not seeing the work, I'll help you all day.
Okay. I love it. Yeah. I nearly, I don't know how much traffic you want on that, but I've thought about, because now that you've dropped the foundations course to $50, I think I'm really excited to see what happens there. I would say that 9 out of 10 people who leave my office after weight loss counseling are scanning the two codes. They're scanning my fitness app that I designed, and they're scanning the QR code for the foundations course. Some people, again, they're either just not interested or whatever. I don't care. But the idea of having this active challenge where there's some interaction between
Yeah.
the two,
And it's free. I mean, it's totally free. And again, the 8 rules are like basic. Eat out once a month. Most people are eating out 3, 4 times a week.
oh yeah, for
There's a
sure.
certain water metric. Like not there's not a water metric. The main goal is just drink more water.
Yeah.
But it's designed to give them just 8 fundamental habits that they can work on that I can guarantee you would change whatever trajectory someone is on if they do it.
Mm-hmm.
Sign up for it. Go
100%.
for it. And yeah, if they like, tell them if the course isn't there, that's why it's there. I mean,
Yeah, yeah.
if the course isn't their thing, I mean, you're at no risk, no obligation, no anything for this. It's free.
Right, right.
It's, I mean, you will never hear from me again if you don't want to. Like,
Yeah.
you can't lose, and you get a lot of resources in the I don't know why you wouldn't if
Right.
unless you just did not care about or weren't in the place to or interested with,
Mm-hmm.
weight or habits or whatever. And there's people that are like that.
Yeah, for sure.
So
Cool, man.
yeah, I underestimated how many people read the show notes because I started getting emails. They're like, "Well, hey, I didn't get this video. I didn't get video two." And in fact, one guy was great about communicating, and at the end of it, I was just like, I was so grateful for his help and so embarrassed that we had forgotten so many steps in the rollout process. It's like, man, can I send you some stuff like in the mail just as a thanks for being so helpful? And yeah, he was great.
That's awesome. Super cool. Thanks for having me, buddy. I really do appreciate it. This is super fun.
Want to be sure to say thanks to Dylan for coming on and sharing his knowledge. I know Dylan personally, so I know that he had not only invested the time with me doing the actual podcast, but countless hours of going back and looking at data and research. He's just that kind of guy. He wants to be very transparent. He wants to be honest. He wants to be right. And he wants to be helpful, and I respect that a lot about him a lot. So thank him for his time, his preparation, etc. If you've got questions for him, you can reach out to him directly. And again, I will link the show that we did on GLP-1s in the show notes as well, so you can go back and check that out if you have any other questions. Also, you might have heard that he accidentally leaked some information about a challenge that we have recently developed and made live on our website. I think that we have all of the bugs worked out of that. And if you want to check it out, we will put that in the show notes and hope you take advantage of that and see great success with it. He also mentioned that the price of the courses that we have on the website dropped pretty significantly this year. And you can check those out as well. I'll link them if you're interested in looking at those. So if you like this show, one of the most helpful things that you can do for us is you can send it to someone that you think might be interested in it. You can rank the show. You can leave us a comment. You can do all of those things that people always talk about because it actually does help. We appreciate you. We appreciate you listening. We've got quite a few new episodes already in the hopper, as well as many other ones to record. We hope that you enjoy them, and as always, you can send us your questions if you want us to cover those on a Q&A to info@v2pnutrition.com. Until then, we will be back again in another couple of weeks with another new episode.